Welcome to Connect Canyons, a podcast about learning and teaching in Canyon School District. The COVID-19 health crisis has tested us all, and as the school year approaches, many of us are feeling uneasy about what the future holds. But over the past 5 months, scientists and medical professionals have learned a great deal about this disease and how to combat it. Professionals like Dr. Brandon Webb. A Canyons District parent who works with the Division of Infectious Disease and Clinical Epidemiology at Intermountain Healthcare, Dr. Webb works with people who are sick with COVID-19 every day. When case counts started to rise in Utah, he says the medical community was feeling the same sense of unease that educational professionals are feeling today. Fear comes in facing the unknown, and in life there will always be circumstances we can't control. The trick, according to Dr. Webb, is focusing on what we can control and being personally responsible for doing what we know works to stop the spread of COVID-19 while being prudent or taking care to anticipate and plan for all possible contingencies. Medicine, as you know, is a hands-on profession where physical distancing is not always possible, but by taking precautions and being cautious, keeping a distance when possible, wearing face coverings, and practicing good hand hygiene and disinfection techniques, Dr. Webb's team safely treated the patients who came to them in their moment of need. They accomplished this in the highest risk environment possible and while achieving an astonishingly low transmission rate among caregivers. Canyons District's new superintendent, Dr. Rick L. Robbins, recently had an opportunity to meet with Dr. Webb and talk about reopening schools.
Hi everybody, this is Rick Robbins, Superintendent of Canyon School District, and I am thrilled to be here with you today to talk about the return to school and the coming few weeks. And I'm really excited to have our special guest here with us today. This is Dr. Brandon Webb. He's from the Division of Infectious Disease and Clinical Epidemiology with Intermountain Healthcare. And he also serves as the chair of the COVID-19 Therapeutics Committee as well, and is a clinical assistant professor affiliated with Stanford Medicine. So Dr. Webb is also a father in Canyon School District and has children that attend our schools. And so I am just grateful and happy to visit with Dr. Webb today and just talk to him a little bit about COVID-19 and reopening schools and getting this going in a couple of weeks. So, Dr. Webb, I want to welcome you and thank you for being here with us, and just tell you first off, as a frontline worker in defense against this horrible virus, just want to tell you and your staff and everybody that's on the front lines for all you do to keep us safe and to help people recover and get over this horrible thing.
Well,
so welcome.
Dr. Robbins, thank you. And I like that you led with that, because now you and your staff are becoming frontline. So thank you.
All right. Okay. So we're going to just ask Dr. Webb a few questions about reopening school. And I just want to start off, Dr. Webb, just with your thoughts on the overarching importance of opening school.
Yeah. I'll put my father and parent hat on for just a minute. Education is a big part of our family, and it matters a lot in the community. And while there's a lot that we don't know about the pandemic, one thing that we do know is that it's affected all facets of life, including our ability to ensure that the next generation is learning what they need to. And that matters a lot to me, and so that's one of the reasons why I'm delighted to be here.
Awesome. Yeah, we know and understand the abrupt nature that was in March when we stopped school, and the impact of students, one, really losing academically, but as you mentioned, just that overall loss to wellness when it comes to social, emotional, and even physical attributes that kids really need. So great point. So one of the things that we're all concerned about, as mentioned, I think, we're all heading into this scared. There's a lot of fear, including myself. I'm a father as well, and I have a third grader that's going back to school. I have a spouse that's high risk and immunocompromised and also works in the schools. And so the fear amongst our staff and amongst our parents and our teachers and everybody that works in schools is very palpable, and it's very real. And then on the other side of that, we're in this terrible situation where I also have just as much fear, and I'm frightened by the loss already to our students, and potentially more if we don't return to school. So I just want to get your thoughts and your mindset and approach to opening schools safely.
Yeah, well, thank you for that. I like that we are recognizing that there's fear involved with the uncertainty. And then when I look back at my experience with the healthcare industry, facing the same question of uncertainty, but several months ago, only the uncertainty was we now have COVID on our doorstep. How are we going to protect our nurses and pharmacists and physicians and staff? There was a lot of fear because we didn't know what we didn't know. And here we are 3 or 4 months later, we have learned a tremendous amount about this virus. And while there's still a lot that we don't know, there are some very, very important principles that we do understand. And if we put those principles into practice, we can successfully decrease the risk of transmission dramatically. So I would suggest that the antidote to fear in a time of uncertainty is identifying what we do know, putting those principles into practice, and then taking responsibility, each one of us, for applying correct principles and decreasing the risk in our own environment. And that's worked tremendously well in the healthcare industry. We watched the frontline caregivers take responsibility for their own environment, for their own protection. And we've got very, very low rates of transmission using protective equipment that's not that different than what you and I are wearing right now.
Well, that's awesome. I think, a lot of the time we kind of get overwhelmed with the totality of all the guidelines and everything that, we're really looking at, and that can be overwhelming, and it also, creates that unknown because we're just overwhelmed with so much information. Along those lines, there's a lot of discussion about, what works exactly when it comes to mitigation strategies and how they work hand in hand, or how, some mitigation strategies seem to have more of a focus, or people want to anchor to those. I just want to get your thoughts on what works with mitigation strategies, and what are things that we can do to return to school safely using those strategies.
Yeah, that's a great question. One of the things that we do know about the virus is generally those core principles of how it's transmitted. And we know that it's tricky, it's clever, and it's able to be transmitted via multiple mechanisms. And so in terms of strategy for reducing risk, I really look at it as a package. There's no single behavior change or preventive measure that by itself is going to be successful. But taken cumulatively, taken as a whole, our package of protective strategy works really well. We know that it does because even in the highest risk settings, like where I work, we've seen it successfully implemented with very low rates of transmission. So let me give a couple of examples. Cleaning and taking care of the environment by itself doesn't eliminate risk because transmission is important between people. And so if there's no people in an environment, you can clean it to death, but you won't reduce risk. But it's terribly important. And hand hygiene has been again and again demonstrated as effective. Physical distancing, clearly scientifically based to diminish the risk of transmission. Not entirely, but it goes a long way. And when you couple that with masking, with face masks or face coverings, that package of 4 or 5 things tremendously reduces the risk of transmission. And that's not an experiment. We know that from applying it in a lot of different settings.
So along those lines, one of the things that I think is really top of mind for educators is in schools, the inability to physically distance 6 feet. What are your thoughts on that? I have my own feelings about, in schools, regardless of what the schedule is, it's very difficult to keep kids apart 6 feet all the time. And I think, as we've talked before, just the concept of trying to vigorously enforce that, even for parents, that's very difficult to do. Do you feel, in a complementary role with mitigation strategies that physical distancing can be overcome with a combination of those things?
Yeah, so I'm a big believer in physical distancing because we know that the virus is, I give the Charlie Brown example a lot. There's the character in Charlie Brown, I think his name's Pigpen.
Yeah.
But he's got that cloud of dirt around him all the time. That's a good graphic representation of COVID and how it's transmitted. People who have the virus and maybe shedding it without knowing are sort of surrounded by a little cloud, if you will. Further away from the cloud you are, the less likely it is that you'll be exposed to the virus. And that, whether it's 3 feet or 6 feet or 13 feet, the risk just gets further and further diminished the further you are. If you have to be near someone who may have the virus, the benefits of masking both the person who may have it and those who may be exposed is undervalued because it supplements physical distancing in a way that nothing else can. And that's why those two mitigation strategies go hand in hand. Physical distancing is great when it can be applied, but we recognize that there's a lot of situations where it can't, and the masking of both parties dramatically reduces transmission risk.
Okay, well, that's excellent. And as a district in Canyons, we're working to implement as many PPE, as much assistance as we can, as well as airflow in our buildings and air filtration, and looking at our buildings in a different way with classrooms and size, and trying to create that space. So I think your point's well taken. My final question, there's a lot of discussion around the country right now about community spread and transmission. And there's mixed messages coming, from the federal government, even from the state government to schools, which has really made it difficult for us to determine, which information to utilize and when in making these decisions and moving back to school and reopening a school. And for Canyon School District, the communities in our zip codes have all declined in positivity rates, especially since the 1st of July, right? And overall, our positivity rate in Canyon sits within our communities at about 6.8. And I know there's different discussions around what that actually means. What are your thoughts on how a school district should look at community spread and transmission?
Yeah, well, first of all, kudos for looking. I'm a big believer of using data to help make wise decisions, and very supportive of the school district using all of the data available. Epidemiologic data helps us. And one of the ways it helps us is the reality is right now in Utah, we do still have sustained community transmission. And while European countries have gone back to school, many of them were in a position where they didn't have sustained community transmission. We do, but we're watching the data, we're watching the trends, and you're absolutely right. Since, especially since Salt Lake County implemented more robust masking, our rates have trended in a favorable direction. And boy, would we love to see them half what they are now. We still need to pull together as a community to do that. But the data does suggest that we're moving slowly in the right direction, headed into the start of school, which is reassuring.
Yeah, I just think that's a real compliment to Salt Lake County and everyone involved. Like you said, we have a lot of hard work ahead, but it's a real tribute to our community, our parents, our kids, our teachers, everyone in the community that's made an effort to mask up and really, as you mentioned, it really hit home with me the principle of self-responsibility. It's more than about me. It's about protecting you. And if I make decisions through the lens of prudence, then I really have an opportunity to keep myself safe as well as my neighbors and those that I interact with. So, Dr. Webb, before we conclude, I just want to give you the floor and the opportunity to finish with any last statements you'd like to make.
I appreciate it. Yeah, I'm here wearing more than one hat. I'm here because I feel a sense of responsibility. I've spent my whole life training for this, but I'm also a parent of 4 children who attend across the spectrum of middle school and elementary school and high school in Canyon School District. And so this is important to me personally. And COVID has unfortunately been a big divisor in the community. And in order for us to be successful as we go back to school, we really do need the community to pull together. That's the reality. We know a lot about this virus. We know what works. In large part, we know what doesn't work. We know that what works isn't easy to implement, but we know that when the community pulls together and takes responsibility for themselves and also has an outward-facing view, that we can decrease the rates. We've done it successfully. And while we don't know everything that will transpire as we go back to school, I love that the district is committed to adaptive learning and recognizing that there are gaps that we're going to learn as we go. And I'm impressed with that and anxious to help out in any way, because I think that as we go back to school, there are going to be things that will be successful and things that won't be. And as we learn what works and what doesn't, we'll then be able to quickly adapt and flex and tailor to the benefit of the students.
Yeah, I really believe in those principles as well. I think one thing that this has taught me is really a desire to continue to be flexible and responsive to an ever-changing landscape and environment, right? And I think that's a real tribute to everyone in Canyon School District. I think our staff, our teachers, our administrators, our board, they really are committed to the kids and their success. And so those words of wisdom are well taken and much appreciated. With that, Dr. Webb, I just, on behalf of Canyon School District and all of our students, our teachers and staff and our parents, I want to thank you for your great work and just tell you how much we appreciate you taking time to come and visit with us and share your thoughts and insight. I want to wish everybody watching as well best of luck and continue to do the hard work so that we can reopen school and get our kids back to learning and enjoying all the great experiences that we know that they love and we know that they need. So thank you. All right, thank you.
Join us for the next episode of Connect Canyons, a podcast sponsored by Utah's Canyon School District. If you have any comments for us, questions, or ideas for topics you'd like to explore, email us at communications@canyonsdistrict.org. You can also follow us on Twitter at Canyons District. Today's show was edited by Carson Fairborn with assistance from Stephanie Christensen. If you like this episode, please be sure to share it with a friend. I'm Kirsten Stewart, and this is Canyon School District.